Hi, welcome everyone. Again, I'm Richard Mollett with the Long-Term Care Community Coalition. For those of you who are not familiar with us, LTCCC is a nonprofit, nonpartisan organization, and we're entirely dedicated to improving care and quality of life for elderly and adult disabled people in nursing homes and in assisted living. Our focus, and we'll be talking about some of these things today, is policy research and analysis. We use that as a basis for our systems advocacy, as well as for public education, educating residents and families, long-term care ombudsman, attorneys, and policymakers. And we're also the proud home to two local long-term care ombudsman programs here in our home state of New York, just north of New York City. Our website, lastly, is nursingHome411.org. As I mentioned before we got started, everything that we have is on our website. Everything is available to use and to share for free, etc. Thank you. Today's program is the 411 on LTCCC, Fighting for the Rights of Nursing Home Residents. And joining me today is, Eric Goldwine and Haley Cronquist, our senior policy team. Again, for materials from today's webinar, please go to the website, nursinghome411.org/webinar-LTCCC. We're going to talk about some of the things that we're working on that we think are important. A lot of what we spoke about when we were planning this webinar is thinking about the questions people ask us in the course of the year, thinking about why some of this work may be important. What does it mean to residents? What does it mean to people who are working for or on behalf of residents? What does it mean to the people who are making policies and overseeing nursing home care? So I'm going to start off talking about residents' rights and get to some of the fundamentals there. Eric will talk about nursing home data, and Haley will follow that with nursing home oversight, understanding how government oversight does and doesn't work at times. And then I'm going to close up with some a little bit of information on our systemic advocacy and some of our resources on our website. So as I often have done in the past, when I present a webinar, I like to get started just talking about the nursing home reform law. I know that, I'm sure I should say that a lot of you are familiar with the reform law or the regulations to some extent. This is something even though I've been working here for over 20 years now and have dedicated my career to it, it's something that I still think about a lot and think about anew and think it's worth reminding people of, is that the nursing home reform law it's been federal law since 1987. The law was implemented through regulation that came out in 1991. Those regulations were lightly revised in 2016. But essentially, the reason why that history is important is because it's important to know that everything we're going to talk about today, whether starting with residents' rights, and then going to the oversight and looking at the measurement, the data of what is going on, this has been in existence for decades. Nursing homes have known for decades what they are expected, what they are required, what they are paid to do. And that's a really important point, especially when we are now in the midst of the holiday season, and I hear about nursing homes that have little, or people calling out not enough staff on Christmas, not enough staff on New Year's, people being, facilities being understaffed during Christmas week because kids are home from school. And my thought always is, this is not the facility's first Christmas. This is not the facility's first weekend. When we see weekend staffing, we know that weekend staffing tends to drop significantly as compared to weekday staffing. And the same with Christmas and other holidays, is that we expect nursing homes to be providing good care for every single resident based upon his or her needs, his or her goals, and his or her both emotional as well as physical and clinical well-being 24/7, 365 days of the year. That's what the law requires, and it's required it for quite some time. The problem, of course, is that the There have been a number of studies, including studies that we have done over the years, looking at years upon years of federal data, not our opinion, but just really based upon a lot of data that the facilities themselves report to the federal government. And what those studies all indicate is that too often the baseline standards of care are ignored by nursing homes with impunity. And I think what we're really seeing now, we've talked a lot over the past year about what the Biden administration is doing in trying to implement new staffing standards, trying to implement more transparency requirements, better oversight, although there's some certainly some question about whether we're moving forward in terms of oversight. But we have seen over and over again that nursing homes are able to, and too many do, ignore even the most basic standards of care. And what has been particularly frightening to me over the past, I would say especially 5 to 10 years, is seeing that nursing homes are becoming increasingly sophisticated at being able to leverage that lack of accountability, the lack of quality assurance, to maximize their profits, and unfortunately at the expense of resident care and resident dignity. So I'm going to start off talking about the fundamentals of some residents' rights. I sent an email out a little late in the day. I had several meetings this morning, just as a reminder about this webinar. And as I noted, some of you may have received it, the email from me, excuse me, is that we get a lot of pushback. We get a lot of, and by pushback I mean questions from families who are frustrated, or families that are heartbroken, ombudsmen that are frustrated, attorneys that are frustrated, advisors, et cetera, policymakers that are frustrated. What does it all mean? What is the value of it if facilities can ignore it so much? And my response to that, and I think our response as getting to the core of our mission, is that if we don't know what our rights are, what our residents' rights are, then we can be sure that those rights won't be realized. So yes, it's extremely challenging. Yes, it is often heartbreaking how the extent to which poor care and demeaning conditions persist in far too many nursing homes in our communities and nationwide. But it's the informed policymaker that helps to improve the system. And it is informed families that we know make a difference in the quality of care and the quality of life in their nursing homes. So I want to talk about some specifics. This is just really, I've kind of cherry-picked some things that I think are interesting or important, but I'll get to some more comprehensive information as well. So I want to talk, first of all, what does CMS, the Centers for Medicare and Medicaid Services, the federal agency responsible for overseeing all nursing home care in the country, what do they say about residents' rights? Residents have the right to be treated with dignity and respect. They have the right to privacy. Importantly, I know from families that I have become very close to, this is an issue. They have the right to keep and use their personal belongings and property, and it's the facility's responsibility to ensure that and safeguard that property and the personal belongings. So if a resident has a ring that has a sentimental value, or a necklace that has sentimental value, if they're using eyeglasses or a hearing aid or dentures, they have a right to use them. They have a right to keep them with them, and it's the facility's responsibility to safeguard them. And if the facility fails, it's the facility's responsibility to replace them. Facilities can't, just as a reminder, of course, facilities can't replace the sentimental value of something that is gone. I'm not saying that, but they have, the residents have the right to ensure that they have, that they can feel comfortable knowing that their possessions are protected and that they have a right to enjoy them. Of course, residents have the right to, not of course, but residents do have the right to manage their own money or to choose someone else to do so. It doesn't have to be the nursing home. It could be a loved one. It could be a friend. It could be someone else with whom the resident has entrusted. They have the right to see their own doctor. A lot of people don't realize that. Residents have the right to choose their own doctor, and the facility cannot put up artificial barriers to exclude a doctor that the resident wants to have come visit him or her. They have the right to choice over their own schedule, for example, when to get up and go to sleep, and to activities and other preferences that are important to the resident. And lastly, and again, this comes from the federal government. This is not my opinion. This is not something I cooked up in our office. This comes from CMS, and I include the link here at the bottom. Residents have the right to an environment that's more like a home, that maximizes their comfort and provides them with assistance to be as independent as possible. And again, let me just, as I started to say before, say these are significant challenges. I know I've been a family member. I've worked with families that I've become close to and residents over the years. We look at the data, as we'll talk about later. I know that there are challenges to making this happen, but knowing that that is the right, not just pie in the sky, not just a goal, but knowing that this is a fundamental baseline right can help us to advocate effectively for it. I'm going to go quickly through some of these. But again, these are some of the residents' rights that I just wanted to highlight. A facility has to treat every resident with respect and dignity and care for each resident in a way that recognizes that resident's individuality. It's not a factory farm. It's not a warehouse. It's not, that you're just throwing some feed into a cage of gerbils or into a pasture where there's cows or sheep or whatever. This is caring for residents and facilities. Even though they say that they are not making a lot of money, they're getting the big bucks for this. They are getting a lot of money. And there's been, as we have more transparency about that, we can see that there is a lot of money going to the system. Unfortunately, too often the money doesn't go towards resident care. It gets diverted elsewhere. And we talked about just recently at a webinar that we had Ernie Tosh speak at, and that's available on our website. And then the last thing I want to note here on this page, and again, this is from the Federal Rules, Code of Federal Regulations, section 483.10. You can see right there on top, the facility must provide, not may, not if it feels like it, not if it has enough money, must provide equal access to quality care regardless of diagnosis, severity of condition, or payment source. And that's really important. A facility must establish and maintain identical policies and practices regarding transfer and discharge and the provision of services under the state plan for all residents, regardless of their payment source. That is part of the federal rules. And I know we see a lot more issues recently in regard to inappropriate, at times illegal transfer and discharge. There was an article today out of St. Louis, Missouri, of a nursing home that just closed overnight. And that is just one, completely outrageous. And there's so many things that should be safeguarding that to prevent that from happening in that kind of manner. But in any case, these are again, just basic rights. I'm going to just go through them a little more quickly. The intent of the regulation, this again comes from the federal agency, CMS. Each resident has the right to be treated with dignity and respect. All staff activities and interactions with residents must focus on assisting the resident in maintaining and enhancing his or her self-esteem and self-worth and incorporating the resident's preferences and choices. Please, let's just take a moment to think about that, because it is too often contrary to what I hear from ombudsmen from across the country, from family members, from many different states now that we talk to and that we've engaged with. Over and over again, we see that this does not happen. But the fact is, it's required to happen. And how do we get those requirements, implemented in the lives of residents? A couple of quick examples before we move on regarding dignity, dressing, promoting independence and dignity in dining. So I want to focus just on two of these. One is grooming. Residents should be groomed as they wish to be groomed, i.e. hair combed and styled, beard shaved and trimmed, nails clean and clipped. Those are, to me, some of the basic things when I go to a nursing home and see that residents look disheveled, they don't look clean, they don't look well groomed. Those to me are red flags about what is going on in this nursing home, that they're not even keeping they're not honoring their residents, they're not treating them with dignity, and they're not even taking time for basic hygiene. Those are all real red flags. And then the last bullet here, promoting independence and dignity in dining. Again, these all come from the federal guidance or the federal rules. Facility and staff should avoid day-to-day use of plastic cutlery, paper and plastic dishware, using bibs instead of napkins unless the resident wants to use a bib, standing over residents while assisting them to eat, and staff interacting and conversing only with each other rather than with residents while assisting the residents with dining. And this to me just says, again, so much, it's the resident's home. And the federal rules say that over and over again. When they changed when they modified the rules again slightly in 2016, this is something that they focused on to further clarify with those rules and with the requirements for surveyors, the inspectors of nursing homes to be looking at, because this is supposed to be a dignified environment. This is where people live. It's not a farm. It's not an animal cage. It's where people live. And this is what nursing homes get paid to provide. I want to just briefly highlight, as I've mentioned in the past when I've done programs, my programs tend to be pretty substantive and include a lot of information. But everything that we've talked about here is available in a number of different ways on our website. One is we have a primer on nursing home quality standards. You can see the picture here, and it's available in the Learning Center of our website. It's free to download. You can use it as a PDF, which makes it very easy to search through the table of contents, or you can print it out and take it with you. I know ombudsmen who do that. I know family councils and resident councils that use it as well. But you can see here, maybe a little bit hard to see on your screen, but we have a list of 49 different standards that we have highlighted as thinking are particularly important to residents and to families and to ombudsmen and others who are working with nursing homes. So if, say, you have an issue with getting appropriate activities, you can just click on here, number 15, activity program meets individual needs. And that includes information about, something, what you can use to support your advocacy, whether you are a resident or an ombudsman working with a resident, ombudsman working with families, a family council, et cetera. So this is a really useful resource. It was updated after the rules were updated in 2016. We also have fact sheets. So what we've done over the years is take a lot of those specific issues that are part of the primer and made them into fact sheets. All of the fact sheets that we have, and we have dozens of them, are 2 pages, front and back, maximum, except for, I think, 2 or 3 go a little bit longer than that. But for the most part, they are 2 pages, so easy to print out, easy to share with a resident council or family council, or to bring to a nursing home if you're an ombudsman, or to, if you want to give this to the residents or families that you're working with, to find out what are those residents' rights. And here you can see this is the fundamental resident rights, dignity, and respect. Some of the things we were just talking about are all here on a 2-pager that you can take with you and use to support your advocacy when you're talking to nursing staff, when you're talking to administrative staff. And it doesn't have to be adversarial. A lot of times what we have heard from people, and I'm really grateful for this, is that people said, well, I use these fact sheets and I use them to ask the care staff, these are my rights, how can you help me achieve them? Really, a first step in resident-centered advocacy is helping the staff to understand what the residents' rights are under the federal rules, and what they, how can we make this happen for the resident? And of course, if that doesn't work, this can support a grievance in a facility. It can support resident council or family council, their advocacy within their facility and beyond. So we have, again, a number of them. This I just wanted to point out because it's always been one of our most popular, is resident assessment and care planning. We now have a number of fact sheets and materials on the rights and the expectations for residents when there is an assessment and the care planning that's supposed to come from that assessment. And I think this is the last fact sheet example that I have, is our standards of practice for good dementia care and avoiding inappropriate antipsychotic drugging. We have a whole dementia care advocacy toolkit that really fleshes this out with a number of distinct fact sheets that you can use and share to support better dementia care. And a quick shout out, thanks to the Samuels Foundation for supporting that work about 11 years ago now. So with that, I'm going to stop sharing and hand it over to Eric.
Thanks, Richard. I'm gonna, let's see, we'll go to slide share from current slide, hang tight, and I need to get to Zoom. There. Okay, PowerPoint is showing, I hope.
Yes.
Okay, great. So for the next, I'm Eric Goldwine. I'm our Policy and Communications Director, and I work with LTCCC's data. And for the next 15 minutes, I'm going to talk about, I'll get a little bit into the nitty gritty of some of the data, but I mostly want to talk about why it's important to have these numbers and be able to understand them and to be able to access them, and how it can help your advocacy both at an individual level and at a systems level on the state or federal policy level. So again, my goal here is to help you access and understand nursing home data. It would be great if I know we share a lot of numbers about ratios and about different averages and medians, but what we hope is that you're able to access these yourselves and use that information to your benefit. I'm going to explain why these numbers matter. Then we're also going to look at Nursing Home 411 and Care Compare, which is the federal website, and do a quick tour on how to find information on those websites. So first, why do we care about nursing home data? Let's start with this. And the reason this matters is because data adds measurable quantitative context. Sometimes you might see something or you might get a feel of something, but with so much data at our fingertips, we can actually say, oh, this nursing home has a 3.2 staffing ratio, or oh, this nursing home has an antipsychotic drugging rate of 25%. That's way too high. So these numbers, these data give us a quantitative metric. It can inform consumers, whether you're looking at a nursing home, whether you're trying to understand what's going on at your nursing home or your loved one's nursing home. It can help investigators understand or have context in when they're surveying a facility. It can inform policymakers, media, and advocates. Now, data has many limitations. I'm reminded of back in May 2020, one of the first COVID data sets showed a 80-bed nursing home with 794 COVID cases. COVID was everywhere, but it wasn't so prevalent that each person was getting COVID 10 times at that moment. So you got to look out for that. There's misleading messengers. You might remember a certain former governor of New York State who was undercounting the COVID fatalities in nursing homes. So you want to be aware of who's telling you the numbers. There's also the causation correlation fallacy. On the right, this is one of my favorite diagrams. It's a picture of a sun. Then on the bottom right is sunburn, and on the top right is ice cream. And people might be like, how come whenever I eat ice cream, I'm getting sunburn? And obviously it's not the ice cream that's causing the sunburn, it is the sun that's causing the sunburn. So beware of the causation correlation fallacy, and you can continue eating ice cream on hot summer days without worry that it will give you sunburn. Then lastly, there's missing context. So there might be a nursing home that has a 4.5 staffing ratio, which is on that number alone suggests that's a passable staffing ratio. But if you're there and you see every Wednesday night, every Friday night, there's one CNA for 27 residents, that is important context. And that's something that the 4.5 ratio won't necessarily tell you. So the numbers can only mean so much. You need the broader context. You need to have a feel. When you have a feel for the nursing home, for what's going on, that can give you more context. And then reminder, the number is just a piece of the puzzle. And lastly, as someone who loves numbers, a reminder to trust your gut. If the numbers are saying one thing, but you're in a nursing home and you're like, this staffing is not acceptable, or this is not in my eyes, a 5-star nursing home, there's rampant neglect, abuse, it's your gut is usually telling you something important. So one of the most important pieces of data is staffing data. It's so central to the policy discussions, and it's so central to what's going on, whether you're an ombudsman, a resident, or a family member. And that's because nearly every study assessing staffing shows that more staffing is associated with less abuse, neglect, antipsychotic drugging, substandard care. So better and higher staffing levels save lives. Now, the good news is that now more than ever, there is staffing data available. It's not perfect, but it is available, and it's the best we've had in terms of tracking this. On CMS, they post staffing data for every position, including nurse staffing, such as RNs, LPN, CNAs, and non-nurse, such as LPNs and CNAs. And on LTCCC's website, Nursing Home 411, we share this data as well. So some key terms, there's HPRD, hours per resident day. This is a ratio. Total nurse staff, this refers to RNs, LPN, CNAs, med aid tech, nurse aid and training. You'll hear 4.1 from us a lot. That's the staffing minimum total care staff time per day needed to achieve good clinical outcomes, according to a landmark 2001 federal study. Unfortunately, we find that most US nursing homes are consistently falling short of that 4.1 threshold. And in the second quarter, the US nursing homes averaged 3.66 total nurse staff HPRD. So we're going to talk about finding nursing home data, including data on staffing, including data on ratings. And the two ways primarily we're going to look into are via the Nursing Home 411 website. What we do is we pull federal data and convert that into user-friendly Excel files on staffing, on ratings, and other metrics. And then I'm also gonna give a quick tour of Care Compare. And just to get ahead on this, if anybody has a specific nursing home request, put that in the chat, and I'm gonna try to use that nursing home as an example on our search. This is what our Nursing Home 411 staffing page looks like for the second quarter of 2023. And it's probably tough to see, but this page has each state's census, its staffing ratio, its ranking, and other metrics. And on this page, you can access data sets of nursing staff, of non-nursing staff, of turnover and weekend staffing ratios, and other metrics. And on the next slide, and I'm going to do a little stop sharing and then go back to a spreadsheet. So this is an example of what the nursing home staffing data set will look like. I'm going to just quickly look in the chat. I'm trying to multitask here, guys. We have somebody suggested Newark Manor Nursing Home in Delaware. I'm going to look that up and show you how you'd be able to do this. So this is a Delaware nursing home. You can see you can use the slicer to filter by state. I'm going to filter by Delaware. Delaware doesn't have that many nursing homes. So we're just going to scroll down and, oh, we have Newark Manor right here. So we can see its county, we can see its census. It has 57 residents, 4.2 nurse staff, HPRD. Then you can go into individual positions. You can see the LPN, total nurse aide, contract staff. So 6.4% of the facility is, or of the facility staff are contract employees. So that's just one example. These data sets have 15,000 nursing homes. And I'm hoping here I was able to demonstrate that you can find one nursing home in just a couple clicks of a button. Now, these data sets also have national data. So we can see in the second quarter, this is the overall total nurse staffing for the US, and you can see different state metrics. So if you're interested in Delaware, you can see it ranked 13th in terms of total nurse staffing ratio with a 3.99 ratio. So I'm going to go back to the PowerPoint. Or actually, no, I'm going to stick around here and we're going to go to I'm going to do an example of finding a nursing home on Care Compare. So this is my other favorite way of looking into a nursing home. And I'm going to just look in the chat. We have somebody recommended Applewood, Woodhaven in Michigan. We're going to see if we can find that nursing home. So this is, I'll have the link in the slides, but you go to medicare.gov/care compare, and it has a nice search feature where you can go by state, and let's see, there's Applewood. Here we are, Applewood Nursing Center, Inc. And then on this page, you're able to see some of the basic information about Applewood, including its overall rating, its staffing rating, quality measures, its vaccination rates, 60%. It looks like that's higher than the national average and the Michigan average. You can look up penalties details. So there were, in the last 3 years, 6 federal fines, including fines of $14,000, $42,000. If you're someone like me who doesn't have any familiarity with that nursing home, this might not mean much, but if you're someone who has a family member there, or you live there, or you're an ombudsman covering that nursing home, then this information can provide some context and to how you approach an investigation, or into how you're approaching your own care or your loved one's care. One more thing on the care page I want to focus on is the staffing information. On this page, it provides the total number of staffing hours, which for Applewood is 3 hours and 19 minutes. And then it also breaks it down by registered nurse, LPN, nurse aide. Then it has weekend staffing levels, which are lower, and it has other information. So again, my hope here is to have provided a couple examples, not so you memorize the Applewood nursing home data or their staffing ratios or their amount of fines, but so that you're able to use this information to search for your own nursing home or nursing homes and find some of that important data.
Eric, before
Yes.
we move on, there's a couple questions I think would be useful.
Yeah.
One is, where did the data come from? Is it self-reported, and how current is it? And when is it updated? That kind of, two different people asked that, but I thought
Yeah. So Richard, do you want to take where the data comes from, and I can.
Sure. So the data are reported by nursing homes, but they're based upon payroll records. So that's a federal requirement that the nursing homes report this data. This has actually only been made available to the public since 2017, and it was only required of nursing homes as of 2016. And prior to that, the only information we had about nursing home staffing was what facilities self-reported, and that was for the 2-week period prior to their annual survey. So there were many concerns that facilities were inflating, were not being honest about their staffing, or too many were not being honest about their staffing, or that they were inflating their staffing in the weeks prior to their inspection. So this is payroll-based journal. Again, it has to be based upon the payroll records. It doesn't mean it's perfect, but it's, as Eric said, it's a lot more reliable than anything else, and it is auditable.
And as for the frequency, so CMS will publicly share their quarterly staffing data roughly a few months, or maybe 6 months after the fact. So for example, right now, the most recent data set for staffing is Q2 2023, which covers April through June. I imagine in January, February, we'll have Q3 covering July through September, and then LTCCC will post that on our site in a few weeks after that. So it's a little behind, but typically a low-staffed nursing home 7 months ago is going to be a low-staffed nursing home today. So I mean, there are exceptions, but you can still learn a lot about a nursing home based on what was going on 6 months ago, for better or for worse. And then I'm going to use this to transition to the other data set that it's my personal favorite data set, the provider info data set. And let me share from current slide, which we just published. Share. We just published this data set, and CMS updates it every couple months. But this is a data set that contains, in addition to staffing information, it contains ratings, inspection, whether a nursing home is a sprinkler, whether it has a family council, it has just about everything. I need to skip a few slides. A reminder, all this is going to be available on the webinar page that we'll post on Nursing Home 411. So yeah, so there's roughly 15,000 nursing homes, and CMS data tracks everything from rating to census to enforcement. And on Nursing Home 411, we've put together a page which gives you some of the highlights at the state and federal level, including what percent of a state's nursing homes are for profit, what percent are what we like to call problem facilities, which are facilities that are either rated 1 star, that's the lowest rating, or if they're a special focus facility or a special focus facility candidate. These are poor performing facilities. So we have that here. We also have some state data. We focus on New York. In this case, there's 600 nursing homes. 132 are categorized, and again, this is an LTCCC metric, as problem facilities, meaning that they are 1 star, special focus facilities, or special focus facility candidates. And this is kind of a rhetorical point, but back to when I mentioned the data limitations, we find that in New York nursing homes, only 2.5% of the facilities have an abuse icon compared to the nationwide rate, which is 8%. And I bring this up not to say that there is less abuse going on at New York nursing homes. I bring this up to provide a warning about what data does and does not tell you. This finding does not mean that there's less abuse in New York nursing homes. It merely means that there is less cited abuse at New York nursing homes compared to the nationwide sample. And this could be due to a number of reasons, which we won't talk about here, but I just want to point out that these numbers need context, and that's where a lot of your work comes in as families, as advocates, as ombuds people. Similar to the other data set I shared with you, you're able to download this data in a Excel file and use the slicers and filters. I know it's 1:40. A lot of you might have wanted to do lunch after this, but I wanted to bring some color into this. We have some slices of pie and pizza, and we also have, I couldn't find a good photo of a water filter on the internet, so I actually took this as a Eric original pure water filter photo on the bottom here, but hopefully you can come away with this slide remembering that you can use slicers and filters to break down a data set either by state, by ownership type, or by county, or by rating, or you name it. In this case, we filtered New York State nursing homes by for-profit facilities and those in the Bronx. What else can we find in the provider info data set? You can find anything: ratings, health inspection scores, fines and penalties, whether there's been an ownership change in the last 12 months, whether there's a sprinkler system, whether there's a resident council or family council. If there's not, you might want to start one. And then before I hand it off to Haley, I hope everyone can come away from this part of the presentation knowing that nursing home data can help you, whether it's helping you choose the right nursing home, or whether it's helping you understand what's going on at a nursing home in terms of the staffing or ratings or enforcement history, or whether it's helping you advocate and using data to advocate for better staffing, for antipsychotic drugging regulation. So we hope you can use this data to help. And again, two sources we recommend for looking for this data are Nursing Home 411. That's our website. We're a little biased, but it has a lot of good data. Then there's also the Federal Care Compare website, which is we definitely recommend for finding data. So I'm going to hand it off to Haley.
Hello. Thank you, Eric. And I am I'm in Arizona for the holidays, and so I'm 2 hours behind Eric, but he really got me excited for lunch. So I will just get through my slides. So I'm Haley Cronquist. I'm LTCCC's policy attorney, and I'm going to discuss what we should expect from the states and from the Centers for Medicare and Medicaid Services in ensuring that residents receive the care and services that they're entitled to under federal law. And I will also briefly share what happens when CMS and state agencies fail to hold nursing homes accountable for abuse and neglect. CMS has a really essential responsibility to oversee nursing homes, and it shares that responsibility with state agencies to make sure that nursing homes are meeting the federal requirements for quality and safety. So CMS oversees the state process for certifying nursing homes and provides guidance to states regarding that survey process. And all of that guidance is set out in something that's called the State Operations Manual. And the State Operations Manual is very, very long. It's thousands of pages, it's several chapters, and it also covers different health facilities. So it's a federal document, it's issued by CMS, and it contains all of the survey and certification rules and guidance for nursing home surveyors to assess whether or not facilities are complying with the regulatory requirements. So as I mentioned, I think it's 10 chapters, thousands of pages, and covers, nursing homes, hospitals, laboratories, and I think like home health. So what we did was we put together a guide to the State Operations Manual, which, by the way, I'm going to call this SOM. So we put together a guide, and we have done a webinar on this already, I think in 2021. So you can find that on our website. But our guide focuses on the sections of the SOM that are relevant to nursing homes. So Chapter 7 is kind of that main chapter that focuses on the survey and enforcement processes for nursing homes, but there are relevant sections and other chapters. So that's what I think makes this guide so useful, is that, we really pulled the relevant pieces. So you don't have to go digging through thousands of pages to find what you're looking for. The guide covers important guidance on these 6 categories. So the program background and responsibilities, the survey process, state oversight performance standards, enforcement and remedies, civil money penalties, and information disclosure. But I'm going to talk about nursing home surveys today. So why are nursing home surveys so important? Nursing home surveys are the principal mechanism through which nursing home quality is assessed and compliance with standards is determined. So as advocates and family members and residents, if we know what we can expect from these state survey agencies, we can use that information to ensure good quality for our loved ones. Along with all the guidance in the SOM, CMS also provides the nursing home surveyors with the system to help them identify whether a nursing home is meeting its requirements. So this system is comprised of F tags, and you can find a list of the F tags on Nursing Home 411. And that is, it helps the surveyors understand the requirements and how to evaluate for compliance. And the F tags are also then cited on the statement of deficiencies, which I'll show an example of in just a few slides. But an important note here is that the reality that surveyors often fail to identify nursing home problems adequately, including serious care problems. And I will also show an example of that. This is the scope and severity grid. So this just helps the surveyors rate the seriousness of any identified deficiencies. So the surveyor indicates the level of harm to the resident, which you see on the left-hand side of the grid, and then the scope of the problem within the facility, which is on the top of the grid. And then on the next slide, I'll show you just an example of a statement of deficiencies. So this is known as CMS Form 2567, and it's just the written record of the surveyor's findings. So on the left-hand side, you can see the F tag and the scope and severity that I just mentioned. And then on the right hand, you see the CFR reference. And in the chat earlier, someone asked, what does CFR stand for? It stands for the Code of Federal Regulations. And then below that on the right-hand side, it's the evidence to support the deficiency. So the surveyor, discusses what they saw in the facility, why they cited it, and so on. So in this specific example, the surveyor stated that the facility neglected to provide a resident with the proper medication. And then Eric, yeah, you can go to the next slide. The medication is a really important thing in nursing homes, and I'm actually going to discuss it when I talk about our Elder Justice newsletter. The Elder Justice newsletter, we publish jointly with the Center for Medicare Advocacy, and it highlights so-called no harm citations. So this is when a surveyor goes into a facility, cites the nursing home for non-compliance, but doesn't find resident harm. And when this happens, it's extremely unlikely that the facility will face any penalty. So what's so powerful about the Elder Justice newsletter is, again, we find citations where the surveyor didn't find resident harm, but if you read the citation, it's really clear, at least to us, that there should have been resident harm found. So on this slide is just two examples of how we summarize each citation in the newsletter. So it shows the name of the facility, where it's located, what state, how many overall stars the facility has, and then a summary of, what happened to the resident. And then on the next slide, I highlighted two of our issues from this year, issue 1 and issue 3. Issue 1, we really focused on nursing home residents receiving dangerous and unnecessary antipsychotic drugs. And it's a really, really powerful, I think they're all powerful. I write them, so I may be a little biased, but I really do. I think they're really powerful stories that show that nursing home residents really are being harmed, and the lack of oversight is just really, really alarming. So as I was mentioning, issue 1 is focused on antipsychotic drugging. And then issue 3, we focused on understaffing, and that understaffing is really important, especially this year, because as Richard mentioned earlier, CMS put out the proposed minimum staffing standards. And what's really interesting is that in the proposed staffing standard, they propose 3 hours per resident day. But in this issue where we found resident harm in all of these different citations, most of these facilities were already staffing above 3.0, and there was still harm being done. So it's just really, really important to kind of note that. And you can go to the next slide, Eric. Thanks. So there's a lot of individual advocacy that you can do just on your own. And one of those things, and well, actually not on your own, one of those things that you can do is joining the family council at your facility. And if there isn't one, creating one. So for the last year or so, we've been focusing on a family empowerment project that helps families make changes for their loved ones in nursing homes through the use of family councils. So family councils, if you're not familiar, are a group of residents friends or relatives of residents in nursing homes who can work together to advocate for their loved ones. So these groups serve as a kind of private space for families to voice concerns and work together to find solutions to improve quality. So they can work together, and then they can, go to the administrator of the facility and try to work with the facility to just really improve the care that's going on. And federal law states that families have the right to join together to advocate for their loved ones in these family councils. So you have a right to create them, to join them, to be as involved as you'd like. And they're really important. As we've learned over the last year, there really is power in numbers. So joining together is really powerful and can really make a difference. Part of this project, we hold monthly family empowerment programs. And different people join those. We get family members, we get people who are already part of resident counts or family councils, ombudsmen, and other advocates. And the topics vary each month. Our most recent program was focused on compassion fatigue, which I think is a really important topic, especially going into the holidays when people are already like a little bit more, stressed out than other times of the year. So it's a really good program. You can check it out. They're all on our website. You can go to Nursing Home 411 /families, and you can find our family council toolkit. We offer a free Zoom room. So if you need an online private place for your family council to meet, please feel free to contact us. We can set you up with a Zoom room, and we're happy to join some of your meetings if you want us to, or you can keep them private. It's totally up to you. We just want to provide the space for you to do that. We also have a family council brochure that is on the website, and all the other resources are on the family resources page. So please check it out. And lastly, so as we mentioned earlier, CMS proposed the minimum staffing rule this year. We believe that it is woefully inadequate, and we submitted comments during the comment period saying so. You can find our comments on our website. And although the public comment period ended, I believe, in early November, we still think it's really important to share your thoughts on the rule with members of Congress. Federal representatives have a lot of influence on this process, and so it's really important to share your thoughts with them so that they are more familiar, because obviously they're not totally focused on nursing homes all the time, even though we wish that they were. But it's really important to share your thoughts with them. So you can do that by going to our action center, and then I've circled the action link there. And yeah, that's all for me. So I'm going to hand it back to Richard to wrap us up and go through our resources. Thanks.
Thanks so much, Haley. I'm going to share my screen. Oh, there we go. Just 1 second. Oops, sorry. For some reason, I'm having trouble sharing my screen. Hold on 1 second. While I do this, I'm going to answer a couple of the questions. Some of them we were able to type in, and others I left for discussion. So Charmaine Davis, thank you for asking, was one of the first people to ask me. I wanted to say this: how do you fix the staffing deficiencies? And I would say the staffing deficiencies are really easy. Well, they're easy to fix in that they're simple. They're not easy to fix in that there is a lot of industry. Of course, the industry wants to continue to have, or many of the industry want to continue to have a low staffing. But essentially, kind of like what I said before about dignity in dining and being able to being treated with in a humane way in dining, in dressing, in care, et cetera, is that it's not a warehouse. And so and it's not supposed to be operated like a warehouse. So if a facility does not have enough staff to care for their residents, they should not be admitting new residents. That should be explicitly prohibited. And if they don't have enough staff to care for the residents they have, the facilities have an obligation under the federal rules to implement a safe transfer process for those residents who they can't provide safe care for. And unfortunately, the whole industry has been able to turn turn this upside down, where they say, oh, we need access. We need, people, if we close, people won't have access. But what does that mean if you have access to a place where there's not enough staff to give you the medication that you need, or not enough staff to ensure that you don't get a pressure ulcer, or that you're not malnourished and dehydrated to death? That is not access as far as we're concerned. And by continuing to allow ourselves to be blackmailed by providers, is that we have enabled them to use that as or use this kind of business model to or I should say build on this kind of business model, and expand this kind of business model, so that we see it too often across the country. This kind of feeds into what I wanted to quickly talk about in the last couple of minutes of our program, is where we are in terms of, and some of the things that we focus on, and how I think they fit in with some of the concerns that we hear from residents and families and ombudsmen and attorneys and policymakers every day. Is that essentially, as I said from the beginning, we have strong rules in this country. And the nursing home reform law is really special, and the regulations that come from it are really robust, even getting down to care with dignity, not putting a bib on someone, not diapering someone, making sure that their rings and their clothing, et cetera, are safeguarded. The problem is that we don't have effective enforcement. So if we did have effective enforcement, as you'd see here, we would have these things, because the rules would be implemented. The rules don't just are not implemented in the lives of residents because they exist. Enforcement is necessary. And unfortunately, we've done a number of studies over the years that have shown how enforcement is just not, as I mentioned earlier on, is not ensuring quality, even basic safety and dignity in our nursing homes. So a lot of what we do, this is an example of the senior care policy briefing, another of our materials that Haley works on. This comes out twice a month. We'll show again links to sign up to receive our materials. But the purpose of this briefing is very specifically to provide facts, to provide data, to provide public reporting to counter the industry's arguments that they're not making enough money, that they're providing needed care, that they are, that they are the victims of the system, rather than the residents who suffer from neglect and abuse, and rather than the families who suffer with heartbreak when their residents, their loved ones, are harmed or die unnecessarily. So we use this could be an effective tool. We do share with members of Congress and state legislators as well, but we welcome you to use it and to share it. It really gets at some of the underlying causes of what's going on in terms of the monetary and the financial goals of too many nursing homes in this country. Here again, just a link to some of our specific resources. They're all available on nursinghomeforall1.org. I know someone else asked a question about that. You can use this QR code again to sign up for alerts, or go to nursinghomeforall1.org, join. At the end of every year, we have our annual appeal. We don't ask for donations throughout the year that often, but here during the Christmas and Hanukkah and Kwanzaa and holiday season and end of year, we do have our annual appeal. We ask that you consider supporting us. Every donation is tax deductible and is used, of course, to support the work we were talking about today and beyond. You can click on the QR code to make a donation from your phone or nursinghome411.org/donate. And we appreciate any amount of support. Our next webinar, please save the date, is January 15th, again at 1 p.m. And this will be available on our website to sign up. And thank you for joining us today. I'm going to open it up to a couple more questions as we finish up. I know it's a little bit after 2, but we could stay on. I already answered Charmaine's question about how do you fix the staffing deficiencies. Mary Wayne asked, what do you think are reasons that surveyors failed to find deficiencies? And I would say, you know, she said it's complicated. I think there are different factors, but unfortunately, the problem is, as I was just talking about, is the industry is a Goliath. And consumer-focused groups such as us and other state and national organizations, we're all really small and very small in comparison. The 2 major nursing home and assisted living provider associations, the American Healthcare Association and Leading Age, each sit on $30 million last time I checked their IRS records, excuse me. No one who is caring about consumers has that kind of money. So it's a matter of resources. It's a matter of that resources in terms of that people here, the providers, have the biggest voice when it comes to the state departments of health or state departments of public health and CMS and the federal government. And that's, I think, the last question. I'm not sure. I'm sorry, Victoria, what your question is regarding practice in New York State. But anyway, we thank everyone for joining us today. We wish you a very happy holiday season. Again, if you are able to, we would appreciate contributions to support our mission this holiday season. And we look forward to seeing you again in 2024. Thank you.